Today, we're talking about wound drainage, how to tell when it's helping, when it's harmless, and when it's actually your first warning that something is going wrong. By the end of this video, you'll be able to look at a dressing and feel more confident about what that drainage means and what to do about it. We're often taught moist wounds heal faster, and that's true, but not always. Here's what we don't always say. Sometimes drainage is your first clue that a wound is in trouble, and if we miss it, we miss our chance to act early. For those who don't know me, my name is Dr. Voltaire, a wound care physician, and I've learned, sometimes the hard way, that drainage is more than just fluid, it's data. When you know how to read it, you can step in before a wound goes from stable to dangerous. If you've ever stared at a soaked dressing and thought, is this normal? Should I be worried? You are not alone. And you don't need special tools to figure this out. You just need to learn the patterns. Here's what we'll walk through today. The types of drainage you'll see most often, how to know when the amount is too much, what sudden changes in drainage can mean, the one drainage pattern I always act on, and at the end, I'll give you my 3-question drainage check I use on every wound I see. Let's start simple. Drainage isn't just fluid leaking from a wound. It's the wound's way of talking to you. It's a mix of fluids, cells, proteins, and sometimes bacteria. It tells you if the wound is clean, if it's trying to heal, or if it's struggling. But here's the catch. If we only focus on keeping the dressing dry, or only on the color, we can miss the real message. Okay, let's break this down in plain terms. Serous is clear, thin, watery, usually okay. A healing wound might do this early on. Serous sanguinis is pinkish, watery, often normal. Think of this like gentle cleaning from the inside out. Sanguinis is bright red blood. It can be okay after trauma or surgery, but if it keeps going, that's not normal. Purulent is thick yellow, green, or brown. This is a big red flag. Infection until proven otherwise. Seropurulent is cloudy thin with some yellow tint. This is a gray area. It could mean chronic inflammation or early infection. And here's a bonus. If it smells foul, that's data too. Here's something I want you to remember. One dressing doesn't tell the whole story. It's the change over time that tells us what's happening. If a wound that's always been clean starts giving off cloudy or foul-smelling drainage, that's worth looking into. If drainage increases suddenly or the dressing starts soaking through faster, that's a clue that something's shifted. So when is drainage too much? Here's a simple rule I use. If you have to change the dressing more than once a day because it's soaked, that's too much. If the dressing leaks onto clothing or bedding, that's too much. If the para-wound skin starts breaking down from being too wet, time to change your approach. Let's talk odor for a second. Not all odor is infection, but new odor or odor that gets stronger is always worth a second look. Sweet and fruity? Think Pseudomonas. Foul like rotten meat, maybe anaerobes. Metallic could be blood-heavy drainage. Trust your nose. It's one of your best tools. Let me tell you about Miss T. She had a venous ulcer that everyone thought was fine. But one day, her dressing was wetter than usual. Clear fluid, but way more than before. And the edges of the wound were starting to look macerated, like they've been soaked too long. We switched her to a higher absorbency dressing and added a moisture barrier around the wound. Within 2 weeks, the wound started to improve. Sometimes it's not about changing the whole plan, it's about listening to what the drainage is telling you. Now, drainage is trouble when there's too much, there is a sudden change. It comes with pain, redness, or warmth, or when the patient starts feeling sick. That's when I stop and reassess. Here's your action list. Match the dressing to the drainage. So foam or alginate for heavy drainage, lighter dressings for low. Protect the skin around the wound with zinc, barrier wipes, or film. Reassess often. Don't set it and forget it. Document what you see. Color, amount, odor, and consistency. If it's changing fast or paired with other infection signs, bring in help early. We don't manage drainage just to keep sheets clean. We manage drainage because it tells us if the wound is safe or at risk. Drainage is the wound's way of asking for help. The goal of this video isn't just to show you what drainage looks like, but to teach you how to hear what it's saying. So if you've ever been unsure about what that soaked dressing meant, you're not alone. You don't have to guess, you just have to listen differently. Thanks for watching. If this video helped you, check out my next one on diabetic foot ulcers, why they rarely heal, and what to do first. It's all connected. Stay informed and heal well.